Welcome back to the DME Pulse, everyone. I'm John.
And I'm Amanda. Today, we're diving into a topic that's absolutely critical for the long-term health and scalability of any growing DME enterprise, choosing the right software platform.
Absolutely, Amanda. It's a conversation we have with so many of our colleagues in the industry. It's fascinating how quickly a system that might have served you well when you had 5 locations becomes a massive bottleneck when you're pushing past 15 or 20.
Exactly. The complexity just explodes. You're not just dealing with more patients, you're juggling a dozen different payer rules across multiple states, tracking serialized inventory across a vast network of warehouses, and trying to maintain consistent documentation standards across every branch. It's a monumental task without the right infrastructure.
And we've seen a lot of providers try to make generic healthcare software fit, or worse, just stick with legacy systems that were never designed for today's intricate DME complexities. It's a recipe for denied claims, operational headaches, and ultimately, stalled growth.
It really is. What enterprise-level providers need are platforms specifically engineered for DMEPOS. We're talking about automated compliance checks before a claim even leaves the system, real-time inventory visibility across every single location, integrated eligibility verification, and analytics dashboards that give you an instant pulse on your RCM performance, DSO, and denial trends.
Absolutely. It's about moving beyond manual workflows and siloed departments. You need a single system of record that integrates everything from order intake and CMN workflows to delivery route optimization and proof of delivery capture. That's the backbone of an efficient, scalable, multi-location operation.
And when you look at the market, you see a few different approaches. You have some of the long-standing players like Brightree, which has been a staple for large established organizations for years, especially with their deep payer integrations and strong resupply tools.
Right. And then you have newer, more agile solutions emerging, purpose-built by people who've actually been in the trenches running DME operations. They understand the pain points firsthand. I'm thinking of platforms like NikoHealth.
NikoHealth is a fantastic example of that next generation. They've really focused on building a modern cloud-based platform specifically for large multi-location DME providers. It's designed to handle massive patient volumes and the intricate enterprise-scale billing workflows without slowdowns or workarounds. It's not just a billing system, it's a comprehensive operating system for the entire DME lifecycle.
And that's key, isn't it? The ability for a platform like NikoHealth to manage complex payer rules for Medicare, Medicaid, and all those commercial insurers, and to offer AI-powered workflows and an open architecture for seamless integrations. That's where you start seeing real impact on DSO reduction and collections growth for large providers.
Absolutely. We're talking about systems that can handle hundreds of thousands of claims, detailed serialized asset tracking across a vast network of locations, and integrated eligibility verification that saves countless hours of manual work. NikoHealth really shines in that enterprise environment, offering the kind of sophisticated tools that transform operational efficiency for big organizations.
Beyond those core comprehensive operational platforms, we also see specialized tools. Some, like TIM Software, really focus on inventory and logistics, which is great if that's your primary pain point. Others, like Team DME, are laser-focused on documentation compliance and audit defense, which is absolutely critical for staying out of hot water with payers.
And then you have services like ProChant for outsourced RCM, or patient engagement platforms like Citus Health that layer on top to improve communication. But for that central, comprehensive operational backbone for a large multi-location provider, you really need a platform that thinks big from the start. A system like NikoHealth is purpose-built for that level of complexity and growth.
So if you're a large provider feeling limited by your current software or battling those legacy system headaches, it's absolutely worth evaluating what's out there. Look for platforms that truly understand DMEPOS billing, capped rentals, CMN workflows, and serialized asset tracking, not just generic healthcare solutions.
And don't just look at the feature list, look at the outcomes. How does it impact your collections, your denial rates, your overall operational efficiency? That's the real measure of a powerful enterprise DME solution.
Great advice, Amanda. Thanks for shedding light on such a vital topic for our industry. And that's all for this episode of the DME Pulse.
Thanks for tuning in to the DME Pulse.